We are ICCO Corporation with a global presence across 5 regions and 36 countries and a rich history of over 50 years. Our work focuses on securing sustainable livelihoods and ensuring justice and dignity for all. In Nepal, our integrated programs on food and nutrition security, conflict transformation, fair economic development and public-private partnership has helped us better the lives of over 95,000 households across 15 districts over the past 2 decades. And inclusion is the key value that we work hard to ensure across all our programs. So, in early 2014, when as part of the Organizational Readiness for Inclusion exercise, we asked ourselves, are our programs delivering in a way that no one is left behind? Do our actions challenge stereotypes? Do our projects guarantee representation and meaningful participation from marginalized groups? We said, yes, of course. Over 50% of our beneficiaries are female. We work with marginalized communities in remote terrains. Inclusion is at the heart of all our programs. But ACAP asks that we critically evaluate our organization and our programs against the 4 elements of inclusion: accessibility, communication, attitude, and participation. Starting with something as simple as, are our IEC materials available in alternative formats? 2. Do we create an enabling environment for people with disabilities to actively participate in our projects? We realized it was not always so. With that realization, we rolled up our sleeves and went to work. Foremost, we identified a few key priority areas needing immediate action. A series of capacity building training on disability sensitization and ACAP were held for our staff and our implementing partners. Small budgetary commitments were made to make the office more accessible and gender sensitive. We started evaluating our programs through the ACAP lens and applying the recommendations of ACAP by customizing it according to the local context. A change agent from within our organization was appointed to facilitate and assess the progress of our inclusion mainstreaming process. With the agent at the helm, we were able to further institutionalize inclusion through the development of standard operating procedure with concrete steps to ensure inclusion at all levels of program cycle. Today, inclusion at ICCO is not just a strategy, it is also an attitude. Through this process, first and foremost, we were able to confront our own biases and also help change the attitudes of organizations and communities we work with. Case in point, our accessible toilet design for communities in Makwanpur as part of the EU-supported shelter project in earthquake recovery was adopted by other development partners in Thading and Lamjung. The response for both the communities and the partner has been overwhelmingly positive. The robust system of check and balances that we have developed help us return to the question that first started us on this journey at each level of our program cycle, time and again. The journey is far from over, but by embracing an inclusive approach, we have been able to make directed efforts towards institutionalizing and mainstreaming gender and disability inclusion across all our programs. With the hope that the same journey to inclusion might benefit other organizations, together with our strategic partners, Light for the World and Mission East, we have collated our combined experiences and translated them into the publication, Towards Inclusion, which aims to establish the rationale for inclusion and provides technical advice and tools for putting theory into practice. Let's be part of the narrative for inclusion. Let's be the change we want to see.